Welcome back, team, to Plastic Surgery Untold. We actually got a special edition here in Miami. We're at the aesthetics meeting, the biggest aesthetic meeting in the world here in Miami. So the second plastic surgery capital of the world after Austin. Sorry, Miami. But since we're here, we actually have the pleasure of having one Matt Nykiel. We got our usual suspects, Dr. Arredondo, one Gilbert Signs, the PAG, if you will. We're going to start off, what better topic in Miami than talking about BBL trends and something that we talked about in our course yesterday, Matt. So maybe kick us off a little bit. I know that you've been seeing a lot of BBL reversals and what that actually means, but also we talked about some different kind of requests we're getting from patients.
Yeah, well, thanks, Johnny. Always good to see everybody here at the meeting. So thanks for having me on the podcast. I appreciate it. I think there's an interesting evolution going on with BBLs, right? I think previously, let's say past 5 years, it was all about how big can you get my butt, and it was never big enough for many people. I think, right? That was the primary goal, and I think we're seeing a general shift. Truthfully, I think probably for the better. I think anytime you're at the end of spectrums, I think falling back to more to the midlines probably a little bit more beneficial. So in general, we're seeing people sort of coming in looking more for athletic, more sort of toned, not necessarily big, but I think more balanced type of BBLs. I would say that's one trend, right? And then
we saw a lot of body balancing yesterday and lots of different things about that, to your point.
Yeah, I thought we had a great talk that you and I gave together, and I thought sort of centering it around balancing the body is, I think, forefront, one of the things that's being done the most, at least out on the West Coast. I assume it's probably similar in Texas, although everything's
bigger in Texas. But even with us, we've seen a huge trend, and we talked about it a little bit yesterday. Even a trend more of just this, like you're saying, this big volume butt, but more of this athletic tone butt, and that's why we got Gilbert here, because we talked about cellulite, we talked about skin laxity, so a lot more kind of intricacies, if you will, than just filling the butt.
Yeah, I agree with you. I think sort of along those lines, moving in that evolution sort of period, at least out on the West Coast, what we're seeing is a lot of people sort of wanting BBL reversals, and I think it's a trending topic that moves pretty well on social media, and people look at it, and I think that all kind of sort of flows together, which is just people are no longer interested in having the biggest butt possible, or huge butts, or being super hippie and round. They want it sort of back to more of, I think, a central sort of just elegant hourglass sort of figure.
One of the things that we talked about yesterday, and because I think sometimes BBL reversal gets misused and kind of a misnomer, and I thought you had a great point yesterday that a lot of times when people say BBL reversal, they're just trying to enhance their overall shape, and it's either being too hippie, still being square, because a lot of times it's not just making the butt smaller, it's really trying to improve that overall shape, and BBL reversal, I think people get misused and can a lot of times be treated of cellulite, kind of reshaping the buttock, reforming it, sometimes treating some skin laxity stuff. So something that I think we've all seen in our practice so far.
Well, every other aspect of the body, we talk about making things youthful, making things younger, fresher, and more toned. And that's not just volume. I think that's what people are seeing now, and that's how we're starting to address it. We're addressing the skin laxity. We're addressing the cellulite. So it's a complete game changer. Makes it rolls back the clock almost, makes you look like that basketball booty kind of.
Yeah. And I'd say from a patient standpoint, right, from just sort of a general public standpoint, I think when they use the term BBL reversal, they look at it and they say, I'm not happy with this result. And I think, sure, you could say, well, yeah, that's just because, every once in a while it's just a huge butt that we need to bring that volume down. But I think 9 times out of 10, when people look and they say, I need a BBL reversal, or I'm not happy with this, they may not know what they're looking at, but sort of going back to our talk, it is a fullness at the 8 points. It's squaring of the buttocks. It's a straight torso. It's not having that shape. But to them, it's simply, I want a BBL reversal. I want to change this. But to us, who do this a lot, I think it's actually, the framework's not too bad. We just need to touch a couple things up, and again, just balance the body, get things flowing a little bit better, just sort of improve on the result, and they'll be happy.
And maybe we can touch on 2 things. And one is, and obviously it's been near to my heart if you've been following us, some of the weight loss stuff. Most of us, like myself, gained a lot of weight over COVID. And I think people forget, when you transfer fat to the buttock, if you gain 30, 40 pounds, that butt's going to get bigger.
Oh, absolutely. COVID was, I think, a difficult time for many people. And I think we saw a lot of people when you're at home and there's really not a lot to do. I think it's just people gained weight. They couldn't go out. You couldn't exercise. It is what it is. And you're absolutely right. When you gain weight, right, fat cells increase or decrease based on caloric intake, and the results are going to change. And I think in general, if you showed a photo of my before and then my after, and I was 30 pounds more in my after, I think I'd be hard pressed to say, oh, I like how my after looks better. So you're right. Sometimes it's just centering that discussion on lifestyle.
And that's pretty cool, because this is some of the things with some of the new medications out there that you can actually change and direct that and get people And I think it doesn't change anything from our other surgeries. We want people to be at their ideal weight before we make a decision of where we want to go, because sometimes it may be little touch-ups at that point that they need.
I think you're absolutely right. I think that the best type of body contouring is going to happen when we have your sort of targeted, relatively targeted body weight and your relatively targeted physique. I think if your muscle tone is sort of better when or at its peak when you're coming in, we can really do some neat things, sculpting around the muscles, creating some shape. If we're relatively thin, I think 5, 10, 15 pounds of your weight when we're doing the body contouring, I think you're just going to see a better result. I think you won't see a bad result if you lose a bunch of weight afterwards, but it does make it more difficult. It's harder for us to sort of predict the future of how things are going to lay fat store wise as you lose that weight.
And Gilbert, what about this airbrush idea of treating cellulite? And I know there's a few different options out there, but it's something that's really seemed to come more into the forefront recently, as leggings are still a thing, as again people are looking for more an athletic look rather than just a massive booty. Is that something that you're seeing in your practice?
Absolutely. I want to say that social media again drives that whole market, because so many of our patients bring in their wish photos, and everyone is this like ideal athletic shape that they're trying to achieve. And so I think it's very much the driving force behind treating all these other aspects of that ideal shape, with the cellulite, with the skin laxity, just trying to get that really nice smooth butt.
I actually feel that cellulite is continuing to come more and more into sort of the procedures that we're doing. It's getting pushed more. And you say, well, why is that? And I mean, I know there's some new products that come out, but I think another reason that you're seeing that is we have improved with radio frequency, whether that be a BodyTite or Renuvion. And so we're starting to tackle skin laxity. I feel pretty comfortable telling patients that we're going to see about a 30% soft tissue skin envelope tightening. I don't know what you think, Johnny, but
it's so funny because I'm almost in that same range. I think it varies from body part to body part stuff, but somewhere between 20 to 30%, depending on the specific body part, I think is super realistic. There are a few people that get maybe a little bit more arms, neck stuff. I think really, really respond. And it's funny that you bring that, because we've been working on this whole concept of this luxury legs, and I think this is part of that BBL evolution, and really making sure that you're addressing all the things, because it's cellulite, skin laxity, and volume. And to your point, I think in the past the only thing we addressed was volume.
Yeah, volume, whether that be taking it away or removing it, right? So I think there was this, when you got to the skin envelope and you started to say, well, is this skin laxity? Is this sort of cellulitic, sort of superficial, fascial dimples, et cetera? Well, now actually I think we've gotten a lot better at actually tightening and addressing that skin envelope. And so now I think there's more of a focus, or at least people are saying, well, my skin's pretty tight, but look at this, I still have now some cellulitic dimples that maybe wasn't being noticed as frequently before because we had skin laxity, et cetera. And I think that's part of the reason too that you're starting to see this upward continuing trend of what are we going to do to address the cellulite? Because our liposuction technology has improved, our fat transfer technology has improved, we've started to be able to tighten skin. What's left? Well, now we've got to address the cellulite.
And because a couple of last issues I want to make sure that we get in before, I know you got to run because you got a busy day here at ASAPS, but one is, and this is something that I adopted from you, we've incorporated a lot more high definition liposuction into our practice, which you've been doing for many years. And I think that goes to some of the trends in BBL stuff, because, we hear, I get asked all the time, and we got asked yesterday, has our fat transfer and BBL, request decreased? Both of us were emphatically no. But I think the way people requested, and so some of the high definition has definitely been incorporated, something you've been doing for a long time, and definitely something athletic on the front, athletic on the back.
I think one of the major advances in liposuction, right? I think one of the huge major advances in liposuction was that the technology improved, and the technology improved in a way that we were able to more easily remove fat cells, right? And once that happened, no longer was all your energy being expended on simply trying to get fat out. Your energy is now can be expended on, all right, let's look at this artistic picture. Let's actually see this. Where can we make improvements? Where can we create shadow and definition? Where can we actually give some sculpture back to the body? And in some ways, actually almost restore a better looking figure that was not possible 10 years ago at all.
And Sean, I know you see a lot of weight loss patients in our practice. Some of the things that seems that to be a trend, at least in our practice or in Austin, is with so many people using some of these weight loss medications. You look great. It really treats some of the visceral fat, but we've definitely seen people lose volume in the face and in the butt. And so definitely seen people not necessarily trying to get something a whole lot bigger than they were, but just trying to get back to where they were.
Right. Trying to roll back that clock. And I think that's where the skin laxity has become such a big focus for us too. Now with all these energy devices, we can do the fat transfer, we can increase that volume, but that you don't want to increase so much. You don't want to increase that much. So when you get that skin envelope to shrink, everything just looks so good. And then when you take away from the right spots, it's the positive and the negative spaces that work so well together to really give that look that everybody's looking for.
Yeah, I agree.
And I feel like I wouldn't be doing our listeners a service if we didn't at least address BBL safety, because that's something that, was always in the news and something that I think has just gotten so much better over time. And still occasionally get the question, are BBL safe? And I think in the right hands by the right provider doing the right things, I think they're absolutely safe.
Yeah, I agree with that. I think obviously in general, there's been I think the paradigm shift is just simply this: we do not inject fat into the buttocks muscle, right? And I think which is different than previously. Previously, 5-10 years ago, the discussions were how do you get that fat into the muscle for two reasons: one, that the blood supply was better, so we felt that the take rate was better, and two is we increased the volume of the buttocks, we increased the result, the aesthetic result. And now that we have shifted away from that, obviously for reasons of fat embolisms, et cetera, you have seen a general shift in the safety of it. So I would say yes.
And so many things that we do. I mean, there's new technology out. There's better understanding of anatomy. I think the buttock anatomy is more complex than people appreciate it in terms of the different layers. That's why, I think some of the cellulite treatments have gotten better because we understand some of those fascial bands, some of those things, and the way that we treat this in terms of a lot of stuff. And we spent 4 hours talking about it yesterday, so it shows you how complex, or that we just like to hear ourselves.
Yeah. And I think that's true.
Maybe both.
And I think that's true with a lot of things, right? I think, I think that's what sort of separates someone that like you and myself that does something all the time versus someone that doesn't do it as frequently, right? I think that's what the difference between an expert versus someone who's not is on the surface you say, yep, that's a pretty straightforward anatomy, but I think like anything, you can get into the complexities and you can get into the small fine details. And I think a lot of what separates because we were talking about revisions earlier today, what separates a good or average result from a great excellent result, it really wasn't that much, right? It was sort of going in, it was just it was knowing and seeing the eye to just tweak a couple little things, and then you took that's a good result to, hey, that's really good. How did you do that? It was just those couple little details that to look at the complex things.
And it was so funny because for those of you listening that don't know, Dr. Nykiel and I teach a course here at ASAPS on BBLs and butt implants. And
we actually got 2 courses.
Two courses. And one of the super interesting parts of this was that, and it was his idea. We started as a page of all the things that we've changed in BBL since we started the course, 5 years ago?
Yeah.
I think it's up to 3 pages now because there was too many bullet points. And just shows the true evolution. So some of it is society trains. Some of it is just stuff that we've learned to make it safer, more efficient. And it's funny when people came up and talked to you and they were showing their results and why they weren't getting what you were getting. It's funny, just what you were talking about, the subtle little changes. You're like, hey, move your incision down just 2 inches and you're not going to get that. Hey, rotate them just a little bit like this when you do your fat injection and you won't get that problem. And it's funny how just such a tiny, tiny little difference makes a big difference, especially when we're just looking at an athletic butt and not just the days of just trying to pump as much fat as you possibly can into a butt, I think have gone for the most part.
I would agree. I mean, I think there's always going to be exceptions to the rule, but yeah, I would say for the most part, that's not something that's really getting done as much. Just I think general trends, et cetera, and I think you're moving more towards the athletic shape.
Maybe just to leave people with some last kind of tangible stuff who are listening to this, how would they go about in terms of like an order stuff? And this is something we talked a little bit about. So if they have skin laxity, cellulite, want a BBL, is there a specific order? I'd love to get everybody's kind of feedback in terms of this. If they had a BBL in the past, is it too late to treat skin laxity, cellulite, or are there some options? And how would they go about in terms of like a progression? Yeah,
so I mean, I think in general, anytime you sort of use the term skin laxity, do we have loose hanging skin that needs a different type of addressment of abdominoplasty or tummy tucker, or
we're live here at ASAP, so you get the good, bad, and everything.
I think somebody just went down.
Yeah.
So I think that's so that's the question: is it a tummy tuck? Is it not? If it's skin laxity that we can treat, I think a large question is it's an individual basis, right? What is the major sort of issue that we're dealing with? Is this a fat issue? Is this an adiposity issue? Is this a loose skin issue? Is this a lack of volume issue? And I think that really sort of individualizes it to the person. I think as far as doing cellulite on people that have previously had BBLs, I think It's very straightforward. I think we do it all the time. I'm very happy with our results on it too. I think it's improved. There's definitely a lot of info out there that says cellulite can't be improved. And I don't know where that sort of misnomer came from. I think it comes from the fact that it's unrealistic that you can get every single piece of cellulite out in one treatment. And I think that in general, you will see improvements. And sometimes you may need to do more than one treatment on cellulite, but that's okay because you're constantly moving this in this positive direction. I think that may be why that exists. But I think overall cellulite's a very treatable thing now.
Gilbert?
I just think that, approaching this as a team, surgeon and then extender, being able to address all different aspects. This is really just the beginning of the evolution of BBLs and, just cellulite, and it's just in its infancy, and I'm really excited to see where it goes from here.
Dr. Arredondo?
I feel like I've really enjoyed when we have the cellulite treatment started before surgery, because I feel like those dimples sometimes get worse when you add a significant amount of volume. And so I've liked that as part of the algorithm. But I think when you come back later, I think it also still looks good. So sometimes it's just more patient dependent, kind of like you were saying, like what are our major goals that we're trying to accomplish? What's really their goals? And so then sort of addressing, the treatment algorithm for them.
What's going to be super interesting, and Nykiel and I have talked about it, and we're out of time here, so we'll save it for another day. Got to leave you a little teaser, but some ideas of how we can treat cellulite and maybe do a little expansion to help that butt stuff. So we got some cool stuff coming, some trial stuff that we're going to do to keep making that butt better every day. So thank you guys for tuning in. Dr. Nykiel, thanks for taking time out of your busy schedule to join us. Plastic Surgery Untold, greatest podcast in the world, is voted by us and my mom. But we'll see you guys soon. All right.
Bye-bye.
Bye.
All right.
Hey, do you want to do a quick like an intro of because we just are you doing who they am or where the doc's from? Or
You'll
not?
post it in, but we can.
You want to do the
just we can.
Yeah. Is that cool?
Yeah. Because you don't mind clipping that at the beginning, just an intro. Okay. Yeah, let's do
Do you
it.
want just intro me and say, hey, he's not from okay.
All right, guys, I want to introduce Dr. Matt Nykeil from Southern California, SoCal Plastic Surgeon. You can follow him at SoCal Plastic Surgeon on Instagram. He's a little Insta famous if you don't know him, but you probably do. Thanks for joining us. You want to tell us just a quick little bit about yourself?
Well, thanks for having me, guys. I love being here. I'm Dr. Nykeil. We have offices in Newport Beach and Upland, California. So we're in sunny Southern California. And pretty much our specializations are liposuction, fat transfers, body contouring. I think is really what we do the most. And so I think that's what we're going to talk about here, right?
And that's why you were invited to ASAPS to teach other plastic surgeons your pearl. So appreciate you teaching plastic surgeons around the country your nuggets.
Thank you.